Epilepsy is a chronic, long-standing condition, and it's characterized by recurrent seizures, so more than one seizure, and it is due to abnormal electrical activity or an electrical storm in the brain.
So there are a variety of different causes of epilepsy. Some of them are genetic predispositions, so people who are born with a tendency to develop epilepsy at a period in their life. These are usually syndromes that develop at a certain age. They have certain seizure types associated, may have certain characteristics on EEG, and often have a fairly certain prognosis of whether they will get better and disappear in time or whether they will continue throughout life. There are other causes such as injuries to the brain that may develop, like a stroke or maybe a head injury from a motor vehicle accident, for example. There are other congenital causes or reasons you're born with to cause seizures.
So seizures come in a variety of shapes and sizes. Some seizures are very clinically obvious to recognize. So for example, if somebody stiffens and has shaking all over, a generalized tonic-clonic seizure, that's the type of seizure that does not get missed. However, many persons with epilepsy who present with their initial generalized tonic-clonic seizure may have a history of other subtle seizures that were not recognized. And it's important to know the signs of those subtle seizures. Subtle seizures can involve such things as staring, and oftentimes those are mistaken or misidentified as problems with attention or focus. We see children who have absence seizures who will stare, or patients who have focal seizures with impaired awareness who can also stare. Those types of seizures can be more challenging to recognize. And then other seizure types, such as myoclonic jerks, can be mistaken as people being excessively anxious or excessively nervous, or just having the shakes in the morning. And again, those are important to recognize as seizures, particularly if somebody is presenting with a first obvious seizure, because that means that they actually don't have just a first seizure, they in fact have epilepsy.
And when that seizure takes place, again, my arm would maybe just go up for a second or two. I still have my consciousness, but I'm almost staring off, almost like I'm daydreaming. And someone might say something to me, I won't respond because I'm really not hearing them.
I had my first seizure when I was 17 in my high school. I was in a classroom working on the school newspaper, and I got up and fell to the floor and had a tonic-clonic seizure. We thought it was a one-time thing. I went to the ER, we did some tests, but I was basically told we just have to see what happens next. And then I had my second seizure on a high school trip.
I will tend to go into a daze for about 10 to 30 seconds. I'm not able to hear anyone and I'm not able to talk, but usually I come out of it and it's back to normal.
I have full body convulsions, and when I have my seizures, I'm usually unaware that I'm having a seizure. One of my seizures that I remember very vividly, my first seizure, I tried to talk to let somebody know something was wrong, but I could not speak. But I remember falling over and hitting my head and blacking out.
Some people with epilepsy may have particular triggers that make their seizures occur. And it's important that people with epilepsy make others around them aware of those triggers so we can avoid them in the environment that they're in.
There are common seizure triggers that are present for many individuals with epilepsy, and probably the most common one of those is sleep deprivation. So making sure that you get adequate rest, adequate sleep is really important. For many individuals, stress can also be a seizure trigger. So if there's a lot of emotional stress, mental stress, sometimes a lot of physical stress can also bring on seizures.
My main triggers are stress and lack of sleep. To handle my triggers, I have to make sure that my stress level does not go too high.
So there's a number of steps that an individual can do to help someone who's having a seizure remain safe. One of the first things that you should do is stay with that person, look at your watch, and time when did that seizure start so you know how long it's lasted. The second thing you want to do is make sure that person is safe. So if there's anything dangerous around them, you want to move that away from them. The third thing you want to do is you want to roll them over on their side, and that's because some people can actually vomit during a seizure, and you don't want them to aspirate that down into their lungs when they're having a seizure.
These are the main steps for providing first aid for persons having a seizure. Let's look at each step. If you encounter a person having a seizure, stay with the person and start timing the seizure. Remain calm. It will help others stay calm. Always speak in a kind and reassuring tone. Encourage onlookers to move back and give the person room. Ask someone to stay nearby in case further help is needed. Check to see if the person has a medical ID. Look at your watch and time the seizure from the beginning to the end of the active seizure. Timing the seizure will help determine if emergency help is needed. Key concern should be to try to keep the person safe. During a focal seizure, a person may be awake or confused. To keep them safe, move or guide them away from harm. If they are standing or walking, steer them clear of dangerous situations such as traffic, stairs, or train or subway platforms. If a person is falling or has lost consciousness, and you are able to reach them quickly, gently guide them to the floor or the ground. Put something soft and flat under their head. Move any dangerous objects out of the way. Make sure nothing is blocking their face and mouth, and that they are breathing normally. Turn the person onto their side if they are not awake and aware. If possible, have their mouth pointing towards the side to prevent saliva from blocking their airway. This helps the person breathe more easily. Try to make the person as comfortable as possible. Loosen any tight clothing around their neck. During some seizures, it may look like the person has stopped breathing when the chest muscles tighten. As this part of a seizure ends, the muscles will relax and breathing will resume normally. Rescue breathing is generally not needed.
One of the most important parts of caring for a person with seizures is to make sure that you don't put anything in their mouth. One of the biggest misconceptions about seizures is that a person having a seizure would swallow their tongue, and that's simply not true. You shouldn't put anything in the mouth of a person having a seizure until they're awake and they are able to swallow. The one instance where it might be okay to put something in the mouth is if they have a rescue medication that has been prescribed by their medical team to be given to in the mouth to stop their seizures. We don't want to restrain a person when they're having a seizure, so don't hold them down. If they are walking around, you don't need to hold on to them unless they're walking into a dangerous situation, in which case you want to redirect them away from that situation. What's most important here is that we're not trying to make the situation any worse. And sometimes when seizures are over, people can become somewhat aggressive or combative. And for these reasons, we don't want to restrain them or hold them.
It is important to stay with the person until they are awake and alert to keep them safe from injury. Most seizures will end on their own within a few minutes. If a person is having any breathing difficulties, call 911 immediately. Be respectful, sensitive, and supportive. Ask others to do the same. Seizures can be frightening for the person having one as well as for others. People may feel embarrassed or confused about what happened. Keep this in mind as the person wakes up. Reassure the person that they are safe. Once they are alert and able to communicate, tell them what happened in very simple terms. Offer to stay with the person until they are ready to go back to normal activity, or offer to notify someone they want to come stay with them. In some cases, it can be necessary to call for emergency assistance. For example, call 911 if a seizure lasts longer than 5 minutes or the person is experiencing repeated seizures. Call for help if a person does not return to their usual state after the seizure or if they have any difficulty breathing. Seizures that occur in water can be more dangerous because a person may inhale some water. Even if a person has recovered after the seizure, emergency help should be called. If the person is injured, pregnant, or sick, or is having a first-time seizure, always call for assistance. And call 911 if the person asks for medical help.
I remember being at church one Sunday at a men's meeting, and I had a seizure, and we're all sitting in a circle, and one gentleman, he got really excited. He didn't know what to do. He jumped up and tried to grab me, and one of the other men who recognized epilepsy said, "No, let him go. We just got to make sure he doesn't hurt himself." So the gentleman over here, he was educated about epilepsy. When people are educated about epilepsy, they will do much better in working with the individual who has the condition.
When I had my first seizure, one of my school nurses did an excellent job helping me to calm down as I was unaware of what had happened. So she calmed me down. She let me know they had called the EMTs and that they had also contacted my mom and that she was on her way. And helping an 11-year-old scared girl calm down after her first seizure was so important to me because I was able to go to the emergency room unafraid, which was my first ever emergency room visit.
So I think if we summarize all of that information for how to keep somebody safe during a seizure, there's really three things. There's staying with them, there is safe, so keeping them safe, making sure there's nothing around them, and rolling them onto their side. And just by doing those three simple steps, you can really help a person with epilepsy and significantly lessen the risk of any problems as a result of that seizure occurring to them.
Epilepsy is an unpredictable disease, and seizures can occur at any time in any place. And that's why it's important for everyone to be aware of what seizures look like and how to deliver seizure first aid, because you could help save the life of a loved one or a stranger having a seizure near you. To learn more about seizure first aid, visit epilepsy.com.